Hey folks, Dr. Joe Esposito here. I am glad that you're here because today we're talking about your heart. I know everybody wants to have a happy heart. Everybody's heart wants to be warm and fuzzy, but certain things happen to your heart as we get older. And this is just the reality of getting older, folks. And the way I look at it is good for us. We made it. We're still here to worry about these things. So certain things are going to happen. No matter who you are, you can't out-muscle it, you can't out-macho it, you can't out-testosterone it. Certain things are going to happen to your heart for men and women. And I want to discuss some of those things and then what we need to do to slow down that process and prevent a lot of these things from happening. So many things when it comes to health are preventable. You can easily avoid these things, but you don't. And eventually, you're going to have to pay for your sins. I think the Bible says something about paying for the sins of your father. Yeah, you have to pay for the sins of your father and yourself. And we're even finding now in the research that things that your grandmother were exposed to can adversely affect your health. And they did the research on it, if I read it correctly, things that were around a couple of generations ago that aren't around anymore. And how you still can have adverse effects from it because it gets into the grandmother's DNA, which got into the mother or father's DNA, which then got into your DNA. So you're always going to have to pay for these sins. You can't out-muscle some of these things that are going to happen. I always say you can't outrun your fork. Because people say, well, Dr. Joe, I work out 3 times a week or every day, and I'm in great shape, and then I have a heart attack, or I have high blood pressure, I have cholesterol. You can't outrun your fork. If I had to pick the importance of exercise versus nutrition when it comes to your health, I'd say nutrition is about 80-85% of it. Exercise is about 15% of it. So the exercise you might not like to do. Okay, some people don't like working out. However, you have to eat. And so you might as well eat good foods. And if you eat good foods, the chances of your body having issues drops dramatically. Everything from your immune system, Alzheimer's disease, we talked about that earlier, to digestive health, to cancer risks. Why not do it? I don't see a downside taking care of yourself. So let's talk about how aging affects your heart. So as you age, the chance of a heart attack goes up. The average age for men to have their first heart attack is 65. For women, it's 72. But menopause, which women tend to go through around 50, lowers the amount of estrogen that's in your body. Estrogen helps keep the arteries flexible, so the heart attack risk goes up once the estrogen levels start to drop. Now, this is menopause. Estrogen levels drop. Several things happen. We've done shows on women's health issues, so if you want to go to our website, drjoe.com, type in the words women's health issues, and you can listen to the shows we've done, the show we did on women's health issues. I think it was a 2-part show, actually. It was so much to cover. And estrogen is one of those hormones that drops. And several things happen, of course. Your skin becomes less flexible. Your arteries become less flexible. When it comes to romance, there can be dryness because estrogen helps produce lubrication. So estrogen's a big player. Now, the nice part is that we can segue into these different chapters of our lives for men and women and segue with grace and dignity and deal with the changes that occur and love the new things, the good changes that occur. One of the issues that occurs with menopause, of course, is we have to worry less about birth control. Now, you still got to be careful for social diseases, of course, but less risk, zero risk of getting pregnant. So that could be a good thing. So instead of going, oh my gosh, look what happened. Wow, look how good this is. So several of the things we're going to talk about with the heart, you can deal with. Your weight's going to go up. I hear this all the time. I had a guy, was it yesterday, and I was doing a consultation with him. And he's, right around 60 or so. And he said, Dr. Joe, my metabolism's shot. No matter what I do, I can't lose weight. Okay, that's not a true statement. Because you can do certain things to lose weight. It's just a lot harder than it used to be when we were younger. Your metabolism is going to slow down. It happens to everybody. You can't outrun that. But, you can run a little bit and increase your metabolism. But there are certain things that we can do. One of the things is we don't have to eat as much as we get older. We just eat like we used to. I've dealt with a lot of professional athletes, football players. I stopped playing football, but I didn't stop eating. A football player can eat thousands of calories a day, a professional football player, and maintain that big, bulky size. The day they stop running like they used to or playing sports, that's when they start putting the weight on. So when you say there's nothing I can do to lose weight, that's not a true statement. You just haven't done the things that you need to do to lose weight. So your metabolism and energy slows down by about 30%. Slower metabolism can make it harder to gain healthy weight too. So when you were young, you'd go to the gym a couple of times, you get all these muscles. Now you go to the gym and you're just trying to slow down, the passing of time. To boost your risk, it boosts your risk of insulin resistance, which is type 2 diabetes, which means the cells are not utilizing insulin like they're supposed to. What does that mean? You have a cell, and the cell has a little keyhole in it. Insulin comes along, it's like a key. It opens up the cell and allows the body to accept glucose into the cell as fuel. If you eat a lot of sugar, your body produces a lot of insulin. And so the cells get bombarded by insulin, they keep getting opened up and sugar keeps getting dumped in there. Eventually the cell says, wait a minute, I can't take any more sugar. If I take any more sugar, it's going to gunk up the work. So I'm going to resist insulin from opening me up. And that's called insulin resistance. So now what happens is sugar floats around in the blood and you have high blood sugar, called what? Diabetes. But now the cells might need the sugar and they're resistant to the insulin. So now they're going to be stubborn. I'll show you. I'm not going to let any sugar into my cell. And the cells can dysfunction because they're not getting the proper amount of fuels. So as you get older, insulin resistance, high cholesterol, high blood pressure, obesity, these all increase the odds of heart disease. Now, I just read an article yesterday, I think it was yesterday, on the ketogenic diet. Because people say, Doc, I'm on keto and I'm losing weight like crazy. I ran into a chiropractor friend of mine at an award ceremony. In fact, I don't know if you knew this, Joe. I got awarded a Health Practitioner of the Year in Georgia. Not nice. I got a nice award for that. And I was at this meeting, and my fellow health practitioners were there, and lots of applause. And one of them came up to me, had prostate cancer. This guy I went to school with, and he consulted with me on what to do. I felt like the priest coming to confession. People come to confession. Another guy had lost like 200 pounds, and he's still very big. I don't know how big he was. But he says, I'm on a ketogenic diet, and I feel great. And I'm just eating bacon and hamburgers, and I'm feeling great, and I'm losing weight. Well, the study shows that if you are on a ketogenic diet, your low-density lipoproteins, your bad cholesterols, start to spike, go up. Bad cholesterol, low-density lipoproteins are the things that stick to the artery walls and increase your risk of heart disease. So I'm not a fan of the ketogenic diet. Now, does it help you lose weight? Yes, but so does a plant-based diet help you lose weight. So the ketogenic diet is easy, I think. I don't know. I don't eat meat. I can imagine it would be easy, sucking down all sorts of heavy meats and everything. That sounds great, butter and and meat and bacon and ham. But there's so many adverse side effects to that. So I'm not a fan of that at all. Now, if you want to lose weight, if you go to our website, drjoe.com, type in the words weight loss and listen to the show we did on weight loss. I'm not going to make this show about that. And we have a 21-day doctor-supervised plan that we put our patients on to lose weight. And it's 21 days of supplements and eating right, and it kind of resets your brain. And then it helps you lose weight long term because the brain is reset. But listen to that show we did on weight loss. It'll explain a lot of that. Other things that can adversely affect your heart as we get older. As you age, the arteries get less pliable. They get less resistant, less flexible. Your heart muscle stiffens up too. This can make it tougher to pump blood, especially as you exercise. That's why sometimes you have a heart attack when you're exercising, because the heart just isn't as flexible as it used to be. So one of the tricks I do to combat that is I take Dr. Joe's nitric oxide support. Nitric oxide opens up the blood vessels and allows the blood to flow more freely. Now, nitric oxide also increases circulation to your brain, your sex organs, your arms, your legs. So circulation is key here. And as we get older, your nitric oxide levels, which you produce naturally, are dropping. So I replace it with a supplement, and that helps increase the circulation. I take 4 a day. Sometimes I'll take 2 a day if I'm going to have a really quiet day. I'm just going to relax. But normally on the average day, I take 4 a day. Pretty good stuff. I like it. Now, that's the number 3 most popular supplement we have. Dr. Joe's Super Greens and Dr. Joe's Essential Source are the most popular supplements. And that's what I consider the minimum supplements everybody should be taking. If you're not willing to do anything else, or if you're the ultimate extreme raw food, vegan, exercise nut, Super Greens and Essential Source should be part of your diet. And they're 2 powders. They taste great. And I mix them with coconut milk, almond milk, just shake it up and drink it. Tastes great, and I think you'll certainly enjoy adding that to your repertoire of health. And I wake up first thing in the morning and take it. This way it's out of the way. And there's mint essential super greens and plain super greens. I like the mint. Has a little sweeter, mintier flavor. But you can decide which one you like. And it's amazingly inexpensive for what you're getting. So Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Nitric Oxide. Great starter kit for your heart. Omega-3 fatty acids are important for brain and heart health. Now, a lot of studies are done on fish oil. I'm not a fan of fish oil. Fish oil is not in the phospholipid form, and the phospholipid form of the omega-3 fatty acids is what we need for our brain to function and our body to function. Krill oil is a little better than fish oil, but algae oil is the purest form. And on the website, drjoe.com, that's the one I take. I take Dr. Joe's algae oil every day. Great for the brain. I take 2 capsules a day. I take 1 gram a day. It's essential. You have to get it from an outside source. It's an essential fatty acid. You have to get it from an outside source. If you're not getting it from an outside source, shame on you. You know now, and you have to get it. It's there. That's why it's called essential. And that can help reduce inflammation, which can help the heart work more efficiently as well. Your blood pressure is going to go up as you get older, many times, around your late 50s, mid to late 50s. So your risk goes up dramatically. And the high blood pressure hardens and damages the smooth inner lining of the artery walls, and it stiffens up the blood vessels, and that increases your risk of having a blockage. So once again, nitric oxide. Listen to the show we did on blood pressure, drjoe.com. Just type in the word blood pressure. Probably our most popular show. I think if I had to go to the website and look at it, probably the most popular show we have. Another thing that many times is causing your high blood pressure is a digestive problem. Your stomach is controlled by a nerve called the vagus nerve. The vagus nerve connects the brain to the nervous system that controls your digestive system, called the enteric nervous system. So the vagus nerve controls the enteric nervous system. The vagus nerve also helps control blood pressure. So if you have acid reflux, heartburn, burping, gas, bloating, many times your stomach is pushed up against the diaphragm, and my doctors can actually massage or pull the stomach down away from the diaphragm. And when we do that, it takes the stress off the vagus nerve, and in countless cases in my career, I've seen patients' blood pressure drop. They've tried everything else, diet, supplements, nitric oxide, everything else, fix the stomach, and then all these other things work. So if you have a digestive issue and you have heartburn or acid reflux and you have high blood pressure, you might want to come see us because many times we can fix that. Also, adjusting the atlas, the top bone in the neck, studies have shown that can help with blood pressure as well. So chiropractic might be, in a bizarre way, the answer to your high blood pressure. So if you do want to make an appointment, if you have digestive issues, neck pain, back pain, shoulder pain, sciatic pain, numbness, tingling, muscle weakness, the nervous system controls everything. Come see us. Let's see if you do have pinched nerves. And if you do, what can we do to fix it? Not treat your symptoms, treat the cause. Every day, patients come in our office and say, Dr. Joe, I heard you say you treat the cause and not the symptoms. That's what I want. So if you want to get well and stay well, I can't promise anything for your specific case. The website is drjoe, drjoe.com. Make an appointment. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. So make the appointment right now. We accept almost every insurance out there. There's 1 or 2 we don't accept, and it's only because they don't pay enough for us to accept it. It's their fault, not ours. If you've ever been in a car accident, ever, if the car was damaged, you were damaged. That's my experience. I teach postgraduate to chiropractors, medical doctors, orthopedists, neurologists, neurosurgeons, physical therapists, lawyers on how to deal with car accident cases. We're some of the experts in the world when it comes to treating auto accident cases. And you want to come see us right away because it's not just about your settlement. You watch the TV commercials. Yeah, get big money, get big money. If you're paralyzed, how much money in the world is that worth? I see these cases all the time. Well, they settled for $800,000. You know, this attorney got me $800,000. First of all, the attorney didn't get you $800,000. They got a settlement of $800,000. Then you pay the doctor bills, and the attorney takes a third or more, and you get the scraps that are left over. So don't be fooled by that. Get the treatment that you need. That's the most important thing. drjoe.com. You can book an appointment right online. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Many times with car accident cases, there's no out-of-pocket expense to you ever. You may even have insurance to cover your car accident. Even if you caused the accident, you still need to come see us. You were still hurt. You still need to get the treatment regardless of whose fault it is. Now, we normally charge $720 for the first visit. That's an exam, x-rays, consultation, first adjustment, going over the x-rays on the follow-up visit, and a complete nutrition evaluation. We've reduced that cost to $299. We're not going to do that forever. So if you want to make an appointment, drjoe.com for you, your friends, your family, and your children. Children need care as well. So you can book the appointment right now if you'd like, drjoe.com. We'd love to see you. Other things that affects your heart as you get older. You get irregular heartbeat, many times related to the digestive system. I had this condition personally. When I was a kid, some of my youngest memories of laying in my bed in Hoboken, New Jersey, is my heart would race, and then it would stop. And then it would start again, and then it would skip beats. And I always thought, well, that's everybody's life. I can remember my bedroom in Hoboken, New Jersey. There's a steam pipe in the corner. And now, of course, as a researcher, I realized it was my stomach. And once I got my stomach fixed, pulled the stomach away from the diaphragm, which my doctors do, amazing results. We see it so often with arrhythmias, so you might want to consider that as well. Another reason to come see us. I don't know how many more reasons you need. Just come see us, drjoe.com. Poor sleep can damage your heart. Aging leads to trouble sleeping. Poor sleep can increase the stiffness of your arteries, and cholesterol plaque can build up, and that can raise your risk of heart disease. So even your sleep patterns can have an adverse effect on it. How about a broken heart? There's actually a thing called broken heart condition, a broken heart syndrome. Temporary chest pain, shortness of breath usually affects women after a high-stress event like death of a loved one, a divorce, traumatic diagnosis, or an injury. But you know what? It affects men too. You can actually die of a broken heart. Now, you may see this with elderly couples sometimes. They've been together forever. One spouse dies, a few weeks later, the other one dies. You can actually die of a broken heart. So if you feel like you're having a heart attack, of course, always get that checked. Most people who get it are over the age of 50, but you can have your heart broken younger in life. But if you have that condition, you might want to take care of your physical body, chiropractic care, your chemical body, nutrition, your digestive system, which my team is really good at dealing with those three things, and then you might want to consider counseling as well. I am a huge advocate of counseling. I think everybody should go to counseling. We all have issues in our lives, and so I'm a huge fan of people going under counseling because sometimes you'll be amazed at the stuff that comes out, and you never thought about it, and then you're able to deal with it. So if you have a broken heart, it's not something you just want to sit home and weep. Don't think that just tough it up, suck it up. No, it's actually a serious condition. And we're talking today about things that can affect your heart as you get older. Higher risk of diabetes. Estrogen plummets, we talked about that. Your body doesn't use insulin as well as it used to. That raises your chances of getting diabetes. So over time, high blood pressure can damage blood vessels and nerves that control your heart. Now, I love this medical research that came out, the blood vessels and nerves that control your heart. But they didn't say in the research that pinched nerves can affect the nerves that control your heart. This is why chiropractic is so popular, why so many people are under chiropractic care, because they finally get it. It's not just for pain. But if you have a pinched nerve going to your liver, your spleen, your kidneys, your prostate, your sex organs, your toenails, everything is controlled by the nervous system. And if you have pinched nerves, not only could it hurt, but 90% of your nerves don't feel pain. You can have a pinched nerve and not know it. So it's important that you get that checked, the nerve supply, even if there is no pain. I went to the dentist just the other day, going to him for years. He did work up on me. He checked here, checked there, checked around. He says, okay, things are looking good. You have a little spot here. We're going to monitor that. But I got a checkup. You should probably get a checkup of your spine too, because the earlier you find something, the easier it is to fix. So, and again, if you want to make an appointment, drjoe.com, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Half of our patients have insurance, half don't. So if you don't have insurance, it's extremely affordable to be a patient in our office. And we even take Medicare and better. We take almost every insurance out there. But if you don't have insurance, please don't let that be a barrier in you getting in to see us. drjoe.com. The blood vessels narrow as we get older. That's hardening of the arteries. That's arteriosclerosis. And that can come from plaque building up. Now, if you have that issue or if you have a family history of it, you might want to go to our website, drjoe.com, and type in the words cholesterol and listen to the show we did on cholesterol. Because cholesterol is good. Never heard anybody say that before. Cholesterol is good. Cholesterol is the precursor to building blocks to your sex hormones, to a lot of your hormones, your cell walls. Every wall, every cell in your body has what's called a lipoprotein layer. Lipo meaning fat and protein meaning protein. And cholesterol is a big player in making sure it all works together. If you're eating bad fats, you're eating omega-6 fatty acids. What's that? Corn oil, soybean oil, vegetable oils. These things are loaded with omega-6 fatty acids, polyunsaturated fats. And these polyunsaturated fatty acids, the omega-6 ones specifically, cause inflammation in the body. And so if you're eating a bad diet, you can increase your risk of cholesterol. Bad cholesterol sticking to your artery walls. Good cholesterol is important. Bad cholesterol, not so good. There's different types of cholesterol. And so that's why you get your cholesterol tested, your high-density lipoproteins, your low-density lipoproteins, your VLDLs, your very low-density lipoproteins. You get all these checked, and then you look at the ratio and you say, is it good, is it bad? But the studies, clear as day, show that a plant-based diet is the best way to go. So you have to eat anyway. You might as well eat good foods. Now, if you don't know what to eat, go to our website, drjoe.com, type in the words 7 Deadly Sins of Nutrition. The 7 Deadly Sins of Nutrition is a lecture I did out in California several years ago, and we talk about the 7 foods you want to avoid. Then you type in, so what can I eat? So what can I eat will tell you what you can eat. Breakfast, lunches, dinner, snacks, raising kids, parties. It's all there. And by the way, on our website, we have about 2,000 hours of podcast, and we have video of our podcast as well, our video podcasts. All that's absolutely free. 65% of people are visual learners because we have screens all over. So we learn how to learn from watching. So you can watch the videos, you can listen to the audio, listen to them in your car, listen to them when you're working out, share them with your friends. I have schools use my lectures as teaching tools. I'm happy to have schools use my lectures as teaching tools, my seminars. Anything that I can do to help promote this information is what I'd like to do. So the website's a great source of information, drjoe.com, D-R-J-O-E. And if you have any questions, you can always send it to me through the website, drjoe.com. Now, if you want to make an appointment, book it right online. If you're a VA, if you're under Veterans Administration healthcare, if the VA sends you to us, they pay for your treatment. 100%. So they pay 12 visits, and then we can request more. We usually have no problem with that. But if you're under VA care and you want to get referred to us, just ask your VA doctor to send you here. We accept VA patients in all of our offices, Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. If you're a podcast junkie, my website's there 24 hours a day. But you can also listen on the podcast service that you use. Just type in Dr. Joe for the health of it. Dr. Joe, Dr. Joe, D-R-J-O-E, for the health of it. And that's a great way to listen to more podcasts, too. If you have any questions, send them to me through the website, drjoe.com. We would love the opportunity to be your doctors. So if you're sick and tired of being sick and tired, if you have pain, we're really good. I'm board certified in pain management. We'd love to treat you to help get rid of your pain, but not only get rid of your pain, get to the cause of your problem, not just treat the symptoms. All the supplements we talk about available on the website, or you can come see us, pick up the supplements, save some shipping costs. Again, the website, drjoe.com. Tell your friends about the show.